This is Kamala Tamirisa, cardiac electrophysiologist with Texas Cardiac Arrhythmia Institute in Dallas, Texas. And I'm joined by wonderful guests today. One is Dr. Razminia and my co-host, Dr. Eliany Mejia. And we will be talking about radiation concerns, which is one of the potential barriers during, for people who want to consider fellowship or career path in EP. And we want to debunk the myth and then educate ourselves as to why, that's not much radiation, or there's radiation. If it is, what can be done about it? And this is the FHRS TV Women in Mentors series. Thank you, Dr. Mejia and Dr. Razminia. And Eliany, is it okay if we called each other by first name?
That's perfect for me. And thank you so much. This is an awesome panel. And I think that is very important for us as a woman in EP, and to have Dr. Razminia with us is a plus. So we can highlight all the tools that we have in EP. So Kamala, you're being the one of the leaders in women in cardiology, and specifically one of the voices in women in EP. This is a conversation that we need to have, and actually one of the junior EPs. So I've been watching your growth, and seeing mentors and role models has been what actually took me into the field that I am today, when I cannot see myself doing anything else. But what do you think about those gender disparities, the woman representation in EP? What are the limitations behind it?
It's a very relevant question, right? We are nearly 50 years after the field of EP emerged, Eliany. And in 2021, as you know, the JACC article by Abdul Salam and team, basically they surveyed and they found, the disparities we know. The pathway, actually, if you look at in medical school, more women go into medical school than men. And then in residency, our numbers go down, and then 42%. And then we go down to general cardiology, we're about 21, 22% around that. And then if you look at EP over the last several years, we've been anywhere between around, I'll just roughly say around 10%. So there is definitely, whether you call it as a plugged pathway or leaky pathway, there is that. And the question that you asked is, what are the barriers? Well, per the survey done by them and published, they identified several barriers, which are the culture and the environment, including discrimination, sexual harassment, and harassment in general, and radiation concerns. And obviously, today's conversation will be on radiation concerns. Would you like to add anything as my co-woman in EP fellow?
Yeah. So I tell you exactly. So yes, for me, the same thing. As a young fellow, I think that you can be what you can see. So if you don't see too many women in the field of EP, you don't see yourself doing that. And there's not a lot of information for us regarding, mainly actually for procedures, for radiation safety. We want to have a balance between family planning and have also a career. That's what we see as a successful career that we can. So having more information about the track, having more information, more mentor sponsorship, I think that will definitely help. So today I really want to focus, in my case, I'm pregnant now, and I was pregnant during my fellowship. So I think that having Dr. Razminia here will be so important to talk about pregnancy. I think that this is a big topic, because when I work with students and even young cardiology fellows, their main question is, it is safe. Can I be a proceduralist? Can I do procedures while being pregnant? Can I still be an electrophysiologist? Kamala, do you have kids? Did you have, tell us about you.
I have 2 boys, and I had them towards the end of my fellowship, and it's doable, see, and they're older now. Dr. Razminia, tell us more about your family and take us into the radiation, how to avoid radiation, and just give us your pearls.
Sure. First of all, thank you so much for the invite, Eliany. I'm so happy for you. Thank you. Congratulations to you. It's a fantastic time of your life, of course. Basically, as far as radiation exposure is concerned, we all know that by now there are several studies, there are several, articles, and even there are books out there that showing that, at this day and age, we should be able to perform almost every, catheter ablation without using any radiation, of course, except that if you need it, you have to use it. And while you're getting used to it, while you're getting trained, you want to use it by all means, or for those cases that they have, some congenital disease patients, or some, epicardial catheter ablations. So if you need to use the X-ray, by all means, but whenever you're going to use it, you want to see what is it going to add to my procedure? How much is it going to add if I'm going to use X-ray as opposed to relying on mapping system, on my eyes, views and my electrograms, and just can do probably much better, much more accurate, as opposed to showing a cardiac CLOA with few ribs and few catheters going back and forth, that there is absolutely no idea if we are in touch with the tissue or not, if you're just purely going to be looking at the, X-ray where exactly we are located, as opposed to when you're doing it with eyes, and then combine it with 3D mapping and electrogram. When you look at this whole package, you see that, oh my God, it makes a lot more sense. When I say that I'm, let's say, in the junction of non-coronary cusp and right coronary cusp, I'm really at the junction of non-coronary cusp and right coronary cusp. You can see, am I on this side of the, raphe? Am I on non-coronary cusp? Am I right coronary cusp? It tells you exactly the most detail if you want to look at those, images. But one interesting thing that I also want to share here, that, I trained fellows for many years until about 5 years ago when I went to private practice. But one of the first fellows that I trained with without radiation, she was, very interestingly, she went to another state, started practicing, and this is almost a decade ago. And she was pregnant, and they had told her that, okay, so we are going to start, your lab, you're going to come after you're done with pregnancy. She had said, no, I'm doing the procedure while I'm pregnant. She was not even using radiation, and she was doing procedures. Of course, if you're going to use, I know that we are going to discuss further about it. If you need to use radiation for any reason, the way that you're going to be able to protect yourself, there are a lot of means by that. But for the majority of catheter ablation of, ablations that she was performing, even though she was pregnant, she was performing procedure without having lead. And
that is a great point. Is actually, this is what we want to highlight. It is completely doable. Having a normal pregnancy and having a normal life throughout the EP training and practices. There's guidelines that has been established about the amount of radiation. Nowadays, we have a lot of tools, even when we do devices or complex devices or extractions that we use, using the lead apron with the skirt that is actually a double layer. So you have at least 0.5 millimeters apron that attenuates more than 98% of the radiation that we are exposed. There's protective screen, there's rad pads, there's even the zero gravity when you really need to use fluoro. But of course, I want all of you guys to stay tuned for the second part that we're going to be talking about zero ablation procedures. This is actually, I think that this is important. You mentioned this is prime time for us. This is an important tool for women in electrophysiology to learn how it is being done. So please stay tuned for our second episode that it will be talking about zero fluoro ablation procedures. Well, see you in a few.